Hello, welcome, and thanks for joining us for the second in our Cancer in the Workplace series. I'm Tim Warren, Commercial Director here at HSC, and today's webinar is talking about cancer, supporting your employees. I'm here in the fabulous Maggie's Drop-In Centre at St Bart's in London, and I'm joined by your hosts today, Janet O'Doherty from Maggie's, a cancer specialised in supporting people with cancer, their friends and families in 22 centres in the grounds of NHS hospitals, and Melanie Jones, a cancer nurse specialist here at Harley Street that specialises in supporting clients and employees with cancer. Today, Janet and Mel will be covering key issues that will help talk about cancer in the workplace with confidence. Firstly, why it's important. Secondly, an overview of cancer, types of treatment and side effects, so you have an appreciation of what someone is going through. And finally, guidance on what types of conversation to have and at what time. So with that, I'll hand over to Janet to kick things off.
Over the past few decades, treatment for cancer has changed dramatically. The introduction of effective screening programs and the advances in available treatments has led to a considerable improvement in survival rates. With more people living longer with cancer, the need for ongoing support from employers has never been greater, and it's expected to increase. By 2030, it's estimated that about half the population will face a cancer diagnosis at some point during their lifetime, and a staggering 100,000 people of working age are diagnosed with cancer each year. Many of these people will continue to work after they've completed treatment, or perhaps they may choose to work even through their treatment. Of course, it's not only the employees living with cancer who are worried about how they will cope with work. Staff members that are caring for loved ones who have the disease will also need to change how or when they are able to work at times. Managers and employers can play an important role in helping staff members affected by cancer by being sensitive to their needs and being prepared to make some adjustments. It's important that you do not underestimate your ability to make a positive difference to someone's experience of having cancer. Being able to continue in work or successfully return to work can actually be extremely important to people. It can help a person maintain a sense of normality at a time of upheaval. It can also provide them with routine, important social interaction, feelings of achievement, and of course a financial income. In providing support, there are clear benefits for the employer too. Efficiency can be maintained and a positive impact on employee engagement can be established. Being understanding and supportive, especially after a period of sickness absence, can minimise additional stress, but you may not feel confident about how to best provide support. We recognise you're likely to have concerns about meeting the needs of your company or organisation as a whole, and also an awareness of how any changes will impact upon other people both practically and personally. We will see during this presentation that open and honest communication is key. But how do you have those conversations that can be potentially tricky? Later we're going to look at this in a lot more detail, but generally managers do understand the need to be sensitive. They're concerned about saying the wrong thing or causing upset. It is likely that you'll be anxious about talking with your employee about their cancer. You'll probably want to think carefully about what you will say. But remember, it's okay to feel lost for words at times or to feel sad. You yourself may have had a personal experience of having had cancer or of caring for a loved one. You may worry that challenging emotions may surface. You may even be tempted to avoid an interaction with your employee, but not talking will make things harder in the long run, so trust yourself to do a good job. Try not to worry too much about how you're doing. Instead, focus on your employee, ask them questions and listen intently. Most people will recognise and respond to the sincere efforts of someone who is genuinely trying to help. It is probable that the employee themselves will also be nervous about discussing their diagnosis with you. They may not wish to disclose a lot of information about the treatments that they will undergo. They may fear they won't receive the necessary support, and they may be embarrassed to talk about the physical details relating to their cancer. If you're able, put them at ease and explain that you won't need all the details straight away. A recurring theme through this presentation will be that everyone is different. There is no one size fits all. One person may be very open with their expectations about what might happen, whereas another will be very private and insist on confidentiality. they may prefer not to disclose any details at all about their illness or treatment. Since no two people with cancer will have the same experience, I'm going to hand over to Melanie now, who is going to talk about some of the different treatments available and the potential consequences that these can have on someone's ability to function in the workplace.
Having an insight into cancer and its treatment can help you understand what your employee may be experiencing, providing you with tips to support them in the workplace. Our bodies are made up of trillions of cells which are essential for human life to function. Cancer can form when genes within cells become faulty and mutate, becoming abnormal. These cells then grow out of control and overcrowd healthy tissue, becoming a mass. These masses of cells can become solid tumours or cancers of the blood and can spread throughout the body, invading other organs and systems. This includes the blood, lymph, immune and hormone systems. If you have an employee who has cancer, they may have had one or a combination of treatments for their cancer. Treatments include surgery, which is the removal of all or of much of the tumour as possible. Time off work very much depends on the extent of the surgery, but can vary from days to weeks or months. They may have had chemotherapy, which is drug treatment, which people generally visit a hospital as an outpatient, but this depends on the treatment and its side effects. It may mean that some people need inpatient admission. You may hear your employee talking about cycles of treatment. A cycle of treatment is basically a session of chemotherapy that includes a rest period before starting the next cycle. Radiotherapy is a form of high-energy X-rays that aims to eradicate cancer cells. It is usually given Monday to Friday and can take a period of weeks, but this is dependent on the individual. The treatment itself only takes a few minutes, but travelling to and from the hospital and waiting times can take up a large part of the day. Some people do work during radiotherapy, but might need to reduce or adjust their hours. Other people stop working completely during radiotherapy treatment and for a few weeks afterwards, as side effects do not always present immediately and can have an accumulative effect. Biotherapies are types of immune therapy that improve the ability of the immune system to detect and destroy cancer by blocking the cancer cell's growth. While treatment is aimed at eradicating or reducing cancer, it can cause a number of side effects that may affect how your employee copes day to day. They may be unable to undertake tasks that they could previously, and it may inhibit communication with you and the team that they work in. A lot of side effects of treatment can be interlinked, and reducing the impact of one can help with the others. Your employee may be embarrassed to discuss how they're feeling and coping, but it's important they feel able to, as it ensures that they receive the necessary support and reasonable adjustments in the workplace to maximise their potential. The way that you communicate and show empathy and care for their situation goes a long way. There are many side effects from cancer and its treatment, but I've highlighted some key ones here. If we start at the top left, we have hair loss. This may affect someone's body image and confidence. Avoiding talking about hair loss can exacerbate the feelings of isolation and embarrassment that people feel. If you feel able to, talk to them about how they are feeling and give positive reinforcement when appropriate about how they look, but be mindful that not everyone wants to talk about how they feel. You must be guided by them. Fatigue can cause extreme tiredness and exhaustion. It's very common and can mean that people are not always able to do things at a pace they did previously. It can also cause mental fogginess, difficulty with concentrating and focusing and finding the right words in conversations. They may also have difficulty multitasking and learning new skills. It can take 6 months to a year, depending on the individual, to resume normal energy levels. It may take longer and can have long-term effects that impact on their work life. Chemo brain is a common term used by people with cancer to describe cognitive problems that can occur following cancer treatment. Symptoms do vary, but can be similar to fatigue, with most symptoms typically disappearing in 2 to 4 years post-treatment. Most people who have cognitive changes are able to do everyday things, but some things not quite as well as before they had cancer. You can help your employee to maximise their potential by not overburdening them with their workload, being mindful of tasks that you set them, regularly checking in with them to see if they are coping, rest breaks during the workday, and flexible working arrangements. It might be helpful to encourage your employee to book annual leave breaks at well-spaced intervals during the year to ensure that they get adequate rest. A reduced immune system as a consequence of treatment may make people more at risk of being susceptible to infections. Ensuring good infection control procedures and health and safety in the workplace helps to minimise the risks for your employees. Examples include having access to hand sanitisers, alcohol-based wipes to clean their desk, keyboard and telephone receiver, allowing your employees to have their own desk space if there are desks, and not hot desking or sharing phones are also good ways to minimise the risks of infection. There may be occasions that working from home may be appropriate to minimise the risk to your employee, or working different hours so that they travel to and from work at quieter times. These adjustments could help them to mix with fewer people who may have an infection. Nausea and vomiting and a reduced appetite may be a symptom of the cancer or the treatment. Some people find that eating little and often and keeping well hydrated can help minimise nausea. They may need a small medication fridge for any prescribed medication and time out for administering it. Having access to fresh air or even a fan can help to ease nausea and symptoms. Allowing your employee frequent rest periods can also help, as reduced energy levels can exacerbate nausea. Anemia is something that can happen when someone's blood count drops with certain cancers and treatment. It can make people breathless and tired, and again, they may need more frequent rest periods. Some people get something called peripheral neuropathy. This is a condition often seen in lower legs and feet, hands and fingers, and can be caused by certain chemotherapy drugs. It can cause tingling, pain, and numbness, which may create difficulties for people with typing, holding a phone, and lifting. Sometimes cells in the lining of the mouth can be affected by treatment, causing soreness, inflammation, and infection. Drinking plenty of fluids is important to keep the mouth moist and hydrated. If you make your colleague a hot drink, they may need to let it cool down so it's warm and doesn't cause undue sensitivity or burn the mouth. Diarrhea and constipation can be a problem that can occur occasionally or frequently. The cancer, medications your employee is taking, and cancer treatments can cause either of these. Having easy access to toilet facilities will be important for your employee, and again, they may need frequent rest breaks. Pain in the treated or operated on area may limit someone's mobility, their comfort, sitting and standing. They may need to review their usual working arrangements to ensure their comfort. This is just a snapshot, and due to the complexity of cancer, the side effects can be quite different, but it's important for you to have some awareness of what they might be experiencing. In our next webinar about making workplace adjustments, we can explore in more detail any ideas we have regarding making reasonable adjustments for your employee. Back to Janet.
It will come as no surprise to you that a diagnosis of cancer is a stressful event. As with any trauma, a period of adjustment is needed. This is true even for those who consider themselves emotionally resilient and have a good network of support. A diagnosis of cancer may have come out of the blue or could follow a period of illness. Initial responses are likely to include disbelief, shock and fear. There will be immediate concerns around who will look after my family if I don't survive, but also worries about how they might feel when they start treatment. How will their appearance change? And how will they cope at work? Some will experience bouts of anxiety or depression, and there are also existential or spiritual questions that arise as people are trying to make sense of what is happening. People will deal with a cancer diagnosis in different ways. Some will be determined to carry on as normal, whereas others may require significant time out in an attempt to process the news and gather strength. It is possible that people may make rushed decisions. For example, they may tell you they need to stop working as a result of feeling overwhelmed. It could be that they haven't fully thought this through. So if this happens, ask them to take some time to carefully consider their decision and encourage them to seek expert advice by speaking to their medical teams or talking things through with professionals from cancer support charities. Throughout someone's cancer experience, the intensity and timing of emotions can be unexpected. Try not to make assumptions about how someone is feeling. You might anticipate that someone who has completed their last chemotherapy treatment and has been told that they are in remission will be feeling on top of the world. But for many people with cancer, these feelings of elation are not present. Many people we talk to at Maggie's find the end of treatment an intensively difficult time. Some only begin to process their thoughts and feelings about cancer at this point. Feelings of confusion, isolation, or a sense of unravelling are not uncommon. The next slide notes the huge range of potential emotions that people with cancer can experience. These emotions are likely to affect a person both socially, psychologically, and can have an impact on a person's private and professional relationships, as well as whether they feel able to cope generally. Loss of confidence, loss of identity, feeling tense, and feeling of failure are some of the emotions that are likely to have the biggest impact in the workplace. Employers and managers need to have an awareness of these. It is possible that individuals will need to seek expert support from cancer support specialists, complementary therapists, or a psychology at some point. We want to spend a bit of time now thinking about formal communication that you will have with your member of staff. Interactions with your employee will be important at each of these key stages. Let's think first about the initial meeting that you have when you learn someone has a cancer diagnosis. At this meeting, your employee may not fully understand how their illness will affect them. Keep in mind too, they may have unrealistic ideas of what they may be able to achieve. Their specialist team may still be gathering information on which treatments are the most appropriate, and plans can change. It's important at this stage to listen intently and try and understand what your employees' needs are. Let them know that you have an open door and are willing to hear their thoughts and concerns. Let them know that future meetings can happen as details emerge. And let your employee know that their right to privacy will be respected. It's worth finding out if the individual would like their colleagues to know. If they do, ask them what, when, and how they should be told. If a person is on sick leave, it's important to stay in touch, but don't assume everyone will need a period of absence straight away. Many people like to keep working for as long as they are able, as it can provide a distraction from some of the worries. Be prepared to make some adjustments, if required. These will need to be in line with equality laws. If you're a large organisation, your Human Resources Department or Occupational Health Services can advise you, and it may be worth checking your policies. When people are undergoing treatments for cancer, it's essential to keep in touch. Decide with your employee how and when this will happen. Some employees may wish to be sent newsletters, and some may like to receive important emails. Others may prefer less contact. If you require a fit note or a letter from your employee's doctors, it may take several weeks. To avoid unnecessary pressure on your member of staff, try and give as much notice as possible that this is needed. And if you need to make changes in the workplace by hiring temporary staff, then be honest with your employee about why this is necessary and offer them assurance that they are still a valued member of the team. Following treatment, when someone is considering coming back to work after a period of absence, it's important to be prepared to make those reasonable adjustments. This could mean providing extra breaks to a person experiencing extreme fatigue or supplying specialised IT equipment for someone who has peripheral neuropathy. Some support in the form of grants may be available to companies who have to supply equipment to support a cancer patient to return to work, so it's worth looking into. For many people with cancer, a phased or graded return to work is beneficial, and this could include some reduced hours, some home working, and not expecting an individual to take on too many tasks before they're ready. During the return to work, keep conversations going. If you're able to maintain a degree of flexibility, this will make a huge difference to the person returning to work. People will still need the occasional time off. There will be follow-up appointments, maintenance treatments, even reconstructive surgeries, which could occur sometime after the initial treatment has ended. Through all of these stages, some of the interactions you have with your employee may be tough. Your employee may be having a difficult time physically and mentally. You may find hearing about this frightening or draining. You may worry about bothering your employee. You may worry about patronising them by suggesting a reduced workload on a phased return. For this reason, it's important to make sure you have the right support in place for yourself. Talking to someone else can help, and having the opportunity to debrief is essential. You could do this with a line manager or a colleague, or you may wish to speak to someone from a cancer support charity such as Maggie's or Macmillan. Rigid absence leave and back to work policies can create a barrier to you providing the support you would like to, and you may sometimes be needed to deliver difficult messages. Distancing yourself from the message you have to deliver by using simple phrases such as "I'm putting on my manager's hat now" can be really helpful. Finally, here are just a few tips about speaking to people with cancer in general. If you have a one-to-one meeting with an employee to discuss things, choose a private space. Don't be afraid of some silence, and check with your employee that they're happy to have the conversations with you. They may prefer to speak with another manager who is more neutral, or perhaps they would be more comfortable discussing matters with someone of a similar age or gender as them. During one-to-ones, try and stay calm. Let your employee know it's okay to show emotion if they want to. Offer empathy statements, but where possible, avoid cliches. Saying things like "it could be worse" or "you're strong and you'll be okay" may not be helpful. If you can, try and refrain from giving advice too quickly. People with a cancer diagnosis are bombarded with all different kinds of advice and information. They can easily feel overwhelmed. Instead of giving advice, consider signposting your employee to other forms of support, such as cancer support charities. Try and resist relaying stories about people you know who have had cancer as well. Few people find this helpful, as everyone is different. Instead, keep the focus on your employee and what their experiences and needs are. Be prepared for one-to-ones to overrun, but also be prepared to cut them short or take a break if someone becomes very distressed. Be aware some people may wish to bring a friend or a family member to a meeting to take some notes. If you haven't understood anything, don't assume what your employee means. It's much better to just ask. Some people use humour to cope. It's fine to respond to this, but don't initiate it. And unless your employee is using metaphors, try not to talk about cancer as a fight or a journey. Using military language can be great for fundraising campaigns, but for individuals it can lead to feelings of failure or guilt if treatment doesn't go as well as they hoped. Also, since cancer arises from the body, to fight them is like attacking oneself. Fighting bravely or travelling along a road also implies some kind of decision or choice. Clearly, your employee was not given a choice about whether they should face cancer. For the next slide, I'm going to hand back to Tim.
Thanks, Janet. I just wanted to finish with a quick word about the support we offer employers and other partners. Through our cancer support programme, we provide a range of support, not just for employees with cancer, but also employers, including those issues discussed today. If you'd like to find out more and are not already working with us, then please do get in touch. Well, that brings us to the end of the webinar. Thanks for joining us today. I do hope that you found this important topic interesting and informative, but above all, actionable. Please don't forget that this is part of our Cancer in the Workplace series that we have running throughout the year. Our next webinar in June will cover employees' rights and workplace adjustments, and I do hope you'll be able to join us for that. And in the meantime, please remember you can view previous editions of webinars on our website. So thank you very much for joining us and enjoy the rest of the day wherever you are. Thanks to those of you that have sent in questions. Picking up the first one, are there any things that you are or are not allowed to ask an employee with cancer?
We would advise that you check with your HR team for any specific guidelines and be guided by what your employee wants to share. Showing empathy and care for their situation should be at the forefront of your mind in all your communication. Janice, is there anything you wanted to add?
So I think it's just important to note that your employee isn't obliged to tell you anything at all, really. So that can make things quite tricky. Mm-hmm. They may have multiple reasons for doing that. They will need to supply fit notes at some point.
Yeah.
I think you have to be really guided by what the individual wants.
Yeah, absolutely.
Great, thank you. The second question is, what are the types of phrase that we should be using with an employee with cancer? If not battle, survivor, etc., what's recommended?
I think it's important that you're guided by their language and how they refer to their situation, picking up on their verbal and non-verbal cues. If you don't know what to say, then tell them that. You're showing that you care about not causing undue upset or anxiousness. Being mindful as well that everyone's an individual and some people are very open about sharing information. You might already have an idea about that depending on the types of communication you've already had with them.
Great, thank you. And should employers prepare their other employers before the employee with cancer returns?
If you've got employees who are upset or anxious about their colleague, then yes, absolutely, you must support them. They may need access to counselling or other talking therapies, but you must remember not to break the confidence of the employee returning to work. Only share information they're comfortable with other people knowing about.
Great. Thank you very much. Those are the questions we have. If there is anything that we've missed or you subsequently think of other questions, then please do get in touch, drop us a line or fill in the contact form on our website.